Hi, everyone. Thank you so much for coming today. I'm super thrilled to have Lindsay from Speechy Things back on the podcast. And we are zeroing in on R Therapy 101 today and teaching the R method. So, welcome, Lindsay.
Hello, thank you for having me.
Such a pleasure. So we'll start with our ASHA required information. Really quickly, if anybody is not familiar, my name is Benita Litback. I go by she, her. I'm the host of the Speechy Side Up podcast, and I have a passion for AAC, assistive technology, and literacy. I'm also an AAC consultant and a certified Learn with Less facilitator, and now a mom to an almost 2-year-old. How about you, Lindsay?
I am the owner and creator. Oh, I'm Lindsay Hochul, first of all, and my pronouns are she, her. I'm the owner and creator of Speechy Things LLC. I specialize in the R sound exclusively now. I currently have a small caseload of private clients. Um, and I believe in progress over perfection, dancing like no one is watching, and above all, free shipping, which feels so funny to say out loud.
Very, very important, especially when you have kids. Lots of stuff to order.
No kidding.
So, here's our agenda for today. We're starting with introductions and disclosures. We'll review how the R sound is then produced. Then, we'll talk about how to decide which R approach is best for your student. Then, we'll review the evidence based strategies for eliciting R in multiple contexts. We'll review a plan for getting R in every context and wrap up with a closing discussion and any questions that you might have.
Awesome.
And then very quickly, my financial disclosures. I have ownership interest in Speechy Side Up LLC and Tassel Learning LLC, and I receive royalties from the Lou Knows What to Do book series. I'm also a member of ASHA's Special Interest Group 12. And Lindsay?
I'm the owner of Speechy Things, so I sell speech therapy materials, and any sale I get a percentage of that sale. I am being compensated for this presentation, and I am a member of ASHA and TISHA, Texas Speech and
Awesome.
Hearing Association,
Yeah, thanks for spelling that out.
just in case.
Yeah. So by the end of this by the end of the session, we hope that you'll be able to describe both retroflex and bunch productions of R, describe clinical decision making for whether or not retroflex or bunch productions of R are well matched strategies to your client, and list at least 2 evidence-based strategies for eliciting R, as well as 2 strategies for eliciting the R sound in multiple contexts. All right, Lindsay, so let's dive in. What are the differences between the retroflex and bunch productions of the R sound?
I love talking about this, and I nerd out on it all the time. Okay, so the biggest difference is the tongue tip and the tongue blade. And of course, I should have a mouth puppet with me. I wasn't even thinking. All right, say this is my tongue. The tip is at the front, the blade is here, body here, root here. The tip for bunched is going to either be pointing straight forward or down a little bit. The tip for retroflex flips up and it's pointing towards your palate. The blade for bunched, I think of it as being up really high and maybe even level or higher than the tip, depending on if you're pointing straight or down. But the blade, so right behind the tip for retroflex, of course, is low because the tip is high. So the biggest differences in the R between bunched and retroflex R happen just at the very front part of the tongue. So really, there's more to say about what they have in common, which is kind of interesting because so many people use some sort of combination or they flip back and forth depending on what word they're saying or what context. Neither is better than the other, in my opinion. Some people would argue that bunched is easier for carryover and generalization. I say try them both. Don't be a gatekeeper. We just need them to say the R. There are plenty of adults who say retroflex naturally. Okay, that's a little soapbox. I have lots of soapboxes when it comes to R. But for both of them, for retroflex and for bunched, there are 2 points of constriction. We have oral and pharyngeal. So basically the way your tongue is moving, because every single part of the tongue has a job when you're saying the R, which is why it's so hard. So whenever you're retracting, you're changing the resonance in your throat, I guess. And whenever you're doing whatever you're doing with the tongue tip, you're changing your oral resonance. So there's 2 different points, which is unique to R. And then, you know what, let's go ahead and go to the next, because the rest of them, in terms of getting retraction, side elevation, and the lips and the jaw, they're actually similar for both, but I think having a visual will be helpful.
Definitely.
I'm going to run through it again, but now specifically just talking about bunched R. So for bunched R, you can kind of think about your tongue sliding back. Sometimes I'll compare it to like a turtle. Does this help you?
Yeah.
A turtle pulling its head back into its shell. Or I could talk about it like if my top teeth are railroad tracks and I'm sliding my tongue, which would be the train, back on the tracks. I feel like for bunched R, bunching it back is how it gets its name. It's also the most common type of R, which is an interesting, or most commonly used, because both are correct, right? But bunched is most common. Anyway, the tongue root retraction, I would say, is the biggest, most important feature of this type of R. Again, so it's almost like you're scrunching it and it gets just big and fat looking in your mouth. Blade and tip are elevated. Tip could be pointed down a little bit. The sides of your tongue are up, okay? So some people will talk about it like taco tongue, or making your tongue shaped like a bowl, or even like butterfly or bird wings. But the sides of your tongue are touching somewhere around the insides of your top molars. And again, you're retracted back. Something that I feel like many people don't realize is that when we're saying the R, either kind, our lips are just a little bit rounded. And it's actually surprisingly very important, because so many times you'll hear people cue a kid to smile, say your R. But actually, when we say red, I mean, it depends on the word, but we have just like a little bit of rounding. And I know that can be tricky because so many kids want to say a W so badly. And then your jaw, so the mouth is open just a little bit. We don't need a huge wide opening. We don't need tight teeth necessarily. They shouldn't really be touching, just a little bit of an open jaw. Any questions about bunched, Anita?
I was going to ask like which one was most popular. So you answered that. I appreciate that. As you're saying it, I'm like playing with the sound in my
I
mouth.
know.
When you are assessing which one works in a child, are you doing it with all of the vowels? Like, I feel like it's hard to isolate the sound, but how do you isolate the R sound? I bet you can.
Okay, this is another one of my little soapboxes. So, you know, later on in this discussion, we will talk about some facilitating contexts,
Okay.
because there are different kinds of R, right? There's R blends,
Mhm.
there's initial R, and then there's all the vocalic Rs, ear, air, ire, or R, and different kids are going to have better success. I mean, it just depends on that child.
Mm.
So I would argue that I never practice R in isolation.
I think I remember you posting about that.
I know, because I just feel so strongly about it. To me, if I isolate an R, like let me hear you say R in isolation.
It's going to sound like Yeah. So when you're assessing it, then do you assess it with each context? Like, do you assess it with, you do, and then you'll say like it's a bunched or a retroflex for each of those productions?
Typically we'll pick one and try to stick with it.
Gotcha.
I will scope it out, and I'll talk to you a little bit about how I do that in a second, but I will try both always with kids and determine which one I think is most successful, and I try to stick with that. But until we have it strongly established, I kind of go back and forth. I mean, I want to make sure I'm picking the variation that's best for them, because it can just be such a barrier to progress. And I've heard too many SLPs message me that once they finally tried, usually it's once they finally tried retroflex with a kid, they got it. So,
Well, I think that's really reassuring for professionals who are listening to this because they're realizing it's a dynamic assessment process. It's not like I need to figure this out in that 30 to 1 hour evaluation session. Like you can be kind of testing this out over multiple therapy sessions. That's
oh,
really
for
great to know.
sure. And that's the case for every single kid that comes in our caseload, right? We are constantly assessing and having to adjust our plan. And I think actually Rebecca Ryan King from Adventures in Speech Pathology talks about this a lot, like trying something, but if you're not seeing the progress you want to see, switch it up. It's okay.
Mhm. So important. I've been thinking about this a lot lately, working in early intervention and just knowing that some kids can go through early intervention for a long time with absolutely no progress and just kind of wishing like the therapist would just switch it up, try something new or suggest something new. I had a little kiddo and we weren't making progress, been working since 1 year of age, got a diagnosis of autism around 18 months, still didn't see progress and had to make the decision to have a conversation about AAC with the family. And thankfully it was well received. And he's just turned 2. We're getting a device, but I feel like sometimes that process of like wait and see can be so much longer than it needs to be when we know like if something's working or not. I think sometimes we just second guess and wonder like, if we just keep trying, maybe it'll change. But I think you do need to change it up after a period of time because most of the strategies work pretty well, like once you start implementing them.
Absolutely. And I think there's a total parallel between treating R and what you were just saying, because so many
Okay.
kids are in therapy for months, years, and they've never produced an R that whole time. And
Mhm.
oh, it breaks my heart. And I can only imagine how frustrating that is for everyone. Well, no, I can't only imagine. I've been there. And and it's heartbreaking. And you just dread that session because you're like, I feel like I've tried all the things. And I don't have a great answer for that other than keep trying all the things, circle back because you never know. Maybe today's the day.
Yeah.
Oh, it's so
Yep.
hard.
It is hard. All right. I just
Extra
moved on
flex
to the
out
next one.
there. No, yeah, that's perfect. Okay, so now a more in-depth look at how retroflex R is produced. This R is arguably easier to teach because it's so much more visible. It's much easier for a child to see if I'm holding up a flashlight, a mirror, if we're taking a video of ourselves to watch back. If you can see underneath the tongue, those blue lines,
Mhm.
and you're at least close to your retroflex R, right? There's at least one thing you're doing. Um, so I think it's quite easy to teach, or easier than bunched, in my experience. Okay, so sorry, were you going to say something?
No, I was practicing it. Sorry.
So we have our tongue curl back, okay? I like to say the tip goes about halfway back in the mouth. Sometimes I'll have kids touch up the middle of their head, point your tongue tip to your finger. And that's the big hallmark feature of the retroflex R. The blade, like we said, the differences are in the front of the tongue, right? The blade is a little bit lower than the tip, but that is just because the tip is pointing up. But everything else is very similar to bunched. We need the retraction. So the back of the tongue is sliding back to the throat. The sides, we still need a little bit elevated, which therefore the middle back of the tongue is lower than the sides. Lips slightly rounded, jaw slightly open. Is that all good? We follow? We're good?
Makes sense. Yep.
Do
Yeah.
you say bunched or retroflex R, do you think?
Let me should I do first to
Sure,
see?
yeah.
Okay. Er, I think maybe, I don't know. Let's see. You can't see that, right?
No, it's small right now on the
Yeah.
screen. But whenever I'm doing teletherapy, I will absolutely have a kid put their mouth right up to the screen. I like even grab a flashlight so that I can see what's going on. It's so hard.
I feel
Is that
like maybe it's retroflex.
mhm.
Maybe. It's interesting because you're saying that like the movement really happens at the very tip of the tongue because it can be confusing. You notice that the tongue does go back, that the sides of the tongue are still kind of like elevated, but then what is happening with the tip of the tongue? So
That's the biggest
yeah,
difference.
yeah.
And one thing that's kind of interesting to me is a lot of people will start with retroflex and then they just naturally morph into bunched over time. Um, and yeah, I just find that so fascinating. You don't know how bad I want my own ultrasound machine so I can like nerd out on this stuff. There's so much research going on with that.
That's really cool. Has Bailey started saying any words with the R sound yet?
I mean, not with an R.
I wonder, I'm sure you're going to be like, which way is she saying it? I'm going to look at Liv tonight and try to figure it out.
That's so
Liv's
funny.
almost 2 now, so I'll just
Yeah,
try to like elicit it and see after we get through this presentation. I'm
you should.
curious.
I should pay more attention. I feel like there was one time I heard her. I mean, she wasn't even saying real words at this point, but there was one time I was like, I think that was an R, but it was during babble. But I was also probably just wishful thinking.
Awesome. All right, you ready to move on?
Yep,
Okay,
yep.
let's do it. So how do you decide which production is best for your client?
Okay. Please always try both. That's my soapbox, right? And
Okay.
it's not just me saying this. There's a fantastic article that I think everybody should read because it's actually really easy to read and every single section of it is clinically applicable. And it's the name of it is on another side, but it's written in 2020 by Preston and a bunch of geniuses. And they say too, explore both tongue positions with all of your students. So I think step one, whenever you're doing any kind of assessment for the R sound, is to do just like a little stimulability check. Check every kind of vocalic R, every kind of R blend, every kind, or not every kind, and initial R. And if any of those sound good, then great, you have your starting point and try to figure out, maybe just talk to the student and ask them how it feels like their tongue is moving. So I think start there, start with their strengths always. If you feel like, even if it doesn't sound 100% accurate, if it sounds better in one context than other contexts, then go ahead and go with that too. So just throwing that out there.
Okay.
So we're listening to what sounds better. You can also absolutely go for what looks a little bit closer. And that's related to my favorite trick that I'll get to in a second. But y'all, I have no shame getting a flashlight, getting out of my chair and looking in their mouth whenever they're saying these words. And I know that can be a little awkward if it's your first meeting, I guess. Feel it out. But it's okay to look and again, ask them what they feel like they're doing. And if they have a preference, if they feel like one feels easier than the other. I have had a student before where I had to really convince them. I'm like, okay, I know you like this one better, but I'm telling you, we need to do the other one.
What made you like think that?
Oh, the sound.
Okay.
It was so much better. And I can't even remember which direction it was.
Mhm.
But it was just, I'm sure, yeah, no, I just remember it was so clearly more accurate with, let's say, retroflex than it was bunched, that we switched to retroflex and then our progress was fantastic.
Awesome.
Okay, so my favorite trick, I'll talk the whole time if you let me. So just like, let me know.
No, this is like that's the point. That's why you're here.
Okay.
I'm here to interview you. We want to hear from you.
Okay, well, please let me know if you want me to like stop and explain or elaborate on
I
anything.
will.
Okay, so my favorite trick, even though I lean toward teaching retroflex, I just find that most of my students do better with that. I usually start by eliciting bunched or cueing for bunched. So I'll explain to them what I want them to do with their tongue. I want the sides up. I want you to pull it back. Actually for bunched, I usually don't even talk about the tongue tip whenever I'm doing this, but what I'm trying to get is just the back features, I guess, of the R. So the sides up and the tongue pulled back. and then I see what their tongue tip does naturally. And for so many of them, whenever they're trying to get retraction, that tongue goes whoop.
Mm.
And if I see that, then usually we go with retroflex. And I bet ya if you try to elicit the R, you don't talk too much about the tongue tip, just see what they do, you're gonna see a ton of tongues doing a backflip.
Mm. That's interesting. That's good to know. Like, what if someone is not understanding that they need to like put their tongue back? I like the one cue you said you give, which is like putting their finger up here and pointing their tongue up. Like, if you're not talking about the tongue tip, like, how do you explain the bunching back?
So there's at least, let's just say 500 ways you can cue.
Oh my gosh. Okay.
I don't know. I mean, that's probably an exaggeration, but there's a lot. And I mean, I come up with stuff on the spot all the time, but a few that come to mind whenever I was talking about the teeth being like a railroad track,
Mhm.
that is a cue I will use to get them to slide their tongue back on the tracks.
Mm.
You could have a hand or a finger in the back of the head and talk to them about, okay, I want you to pull your tongue back towards your hand. I just explain, I want your tongue to move back towards your throat. Um, Talking about tension can be really helpful and important because whenever you're protracting a muscle, you're tensing. So explaining that you want it to feel, I mean, sometimes I'll go through and talk about the whole thing, like what are muscles? What do muscles do? Your tongue is a muscle. Flex your bicep. What does that feel like? I want you to do that in the back of your tongue.
Mm.
What else?
Yeah, those
There's
are
a,
helpful.
well, there's one more. And this, I feel like this is better for an older student. I tried this the other day with, I think he's almost 6, and it was chaos. But I have a Twizzler trick that I like to do. So you cut a Twizzler till it's about maybe, I don't know, it'll fit across the mouth. And I have them use that and push the Twizzler up towards their teeth with the sides of their tongue. And
Is
we
it
kind of
under the
talk
tongue
about,
or above the tongue?
it's on top of the tongue.
Okay.
So I place it like across the back of the tongue.
Mm.
Have
That's
them
to get the
push up.
retroflex?
I actually use it more for bunched,
Okay.
but I feel like you could totally use it for retroflex too, and maybe even talk about like trying to curl around the Twizzler or something. I'd have to
Okay.
play around with that one. I haven't tried it.
Very cool. So I have this resource of yours and it's super helpful. And I forgot about the stimulability check. So yeah, it
It's
looks
new.
like you do have them. This is really?
Yeah. So teaching R is the resource that you're talking about, right? And
Yeah.
it's, I mean, I've had it for years and it's gone through 2 major upgrades, and the most recent one was a year or 2 ago. I
Okay.
don't
I
even,
do have that one.
okay.
I do.
And
Yep.
now, because now it has bunched and retroflex versions,
Hmm.
and this is in the like intro document.
Yeah. I
Uh,
remember it now. So
yeah.
you do have all of the sound, like you have multiple different types of sounds. So when you're doing this, are you like starting on the retroflex side and trying to get some ability and then going to the bunch? Or are you just kind of seeing which one they're doing for each of the words?
I usually see, I mean, it depends on the kid, I guess. Like if they've already got, no, how I would use this for most kids would be to practice the word, but I would cue for retroflex and we practice the word, and cue for bunched and practice the
Okay.
word. If a student already has their R and you think, I mean, really the purpose of this is not so much to find what context is best as it is to figure out if they're trying for retroflex or trying for bunched, which one sounds better.
Okay.
And that's why there's both columns
Got
with
it.
the rating.
And your videos are super helpful. I remember like referring to them quite a bit when I was going through it. So
Good. Yeah,
yeah.
every bottom of every page. That's enough. So you definitely have the new version because that's something I added
Okay.
in this last update is like video instruction links for every page.
Yeah, no, those are gold. I feel like that's super unique to a resource. It's like having you teach it live. That's awesome.
I thank you. I'm really trying to do that in more of my resources. And the biggest part is actually like there was a informed SLP summary about home programming and getting parents to carry things over at home. And it talked about how helpful videos can be. And I was thinking about that, especially as a parent now, because with swim class or whatever we're doing, homework is hard. And I only have one. I have one child, and we're not even really that busy. And it's just hard to do. And so I feel like if I can make it easy for an SLP to just print off a page, send it home, and there's a video already printed that the parents can go, type in that tiny little URL and go find it, then yeah, that was kind of my thought process.
No,
But it's
it's
nice as an
genius.
SLP to have that too.
Yeah, for sure. Definitely. Both are very appreciative of that. All right, you ready to move on?
Yeah.
Okay. So, what are some evidence based strategies for eliciting R?
Okay, so this is the research paper that I referenced earlier.
Okay.
The name was long, so I didn't want to mess it up, but it's free access. It's fantastic. It's packed with helpful information. And while some of these strategies I'm going to talk about, it's kind of fun whenever you've been doing something for years and then you find it in an article and you're like, I knew that word for a
Hallelujah.
reason.
Yeah.
So but anyway, there's tons of information in there, and a lot of these are backed up by that paper, which I just love it so much. Um, but something I want to mention, so it's not just two strategies. I I like to think of cues as something that I layer. There's almost never, just one cue I'm giving a student to elicit the R sound. So we'll kind of talk about that in a second. But I just want to emphasize that every student is different. So I'm going to go through a few of my favorite cues, and they're ones that I've had a lot of success with, but I don't want anyone watching or listening to this to think that it is the way to elicit the R. And if it doesn't work, they're doing something wrong. It just means you got to try something different for that student. So I just wanted to throw that out there.
I think that's really important, though. I hope I'm not interrupting. The
Oh,
fact that you said there's like 500 different cues and that if one isn't working, like try another one. I don't know that SLP is like, I didn't know there were 500 different cues that you could use. I think naturally, like you were saying, like as therapists, when you're doing this for quite a while, you just try different things to see what works for your client. But I think this is like a really important thing for SLPs to remember is that like maybe this is why our kids get stuck because the few cues that you might be using are not working for your client and will never work for your client. So
yeah.
trying all of these other options would be better.
You never know. And it could be that the ones you're using would be great if you just added this one extra support. And
Mm.
don't quote me on the 500 cues.
I know, I
I
know.
don't actually. I just want to make sure people know that. I'm not actually saying there's 500, but who knows? There could be more. I don't know. I just know that there's a lot, and it's okay to make stuff up as you go too. Like that, I feel like that's part of the art of being an SLP, right?
Mhm.
We're creative and we figure out what works for that student. So
Yeah.
I'm just going to talk about some of my favorites, and they're based on what is laid out in teaching R. So
Okay.
basically, I'm like taking you through my resource is what.
Love it. All right, let's go.
Okay. So again, every student's different, but for or if you do your little check and you think, okay, I think this is a retroflex kid. They seem like that tongue position is more successful. It sounds a little better. They're getting closer. Or no matter how I try to cue them, I always see their tongue do a backflip, retroflex. My favorite facilitative context, meaning the vowel that is next to the R shares features with the R. So like for this, for ah, we have, I believe now I'm nervous. I don't have my little visual with me. Hold on.
Go get it.
I know, right? Hold on. I had my note. I'm so sorry.
No, it's okay. And as you're talking, I'm like
Yeah.
doing it along with you.
Thank you.
And we can
Y'all,
do a little demo. I feel like after you explain it, maybe doing a little demo would be helpful.
Yeah, of course, of course.
Okay.
Okay. So for the ah, see, I get nervous with the vowels. I rely on the vowel chart and I use it all the time. So you guys make sure, do you know what I'm talking about? The vowel
Yeah.
quadrilateral?
Yep.
Quadrilateral.
Yep.
Okay. So for ah, we have root retraction and we have a low tongue body, right? And we talked about how because the tip is high, the rest of our tongue is a little bit lower. So those two features are shared with the R. Does that make sense? So
Yeah.
facilitative context are something a little bit newer to me. And Dr. Kelly Farquharson, Class Lab FSU, talks about this all the time. And it was like amazing. Another one of those things, I've been using R forever and now I know why it works. I mean AR, using R forever. Okay, so that's the type of R we're going for with these layered cues. The visual cue that I like to bring out is pictured on this slide. And I like to break down the motor plan into 3 steps. So the verbal cues I give, right? We're layering cues. It's not just one. The verbal cues I give would be to open their mouth and keep their tongue flat, and then curl their tongue slowly, and then close their jaw just a little bit. Now, that is half of what I could cue them for. So you might have to tell them, oh, your lips are too round or too wide. I want you to just round a little bit. You might have to remind them about more root retraction, although because of the ah we're using, hopefully that's not the case. So there's always more you can give them. Just throwing that out there. All right, so we have 3 steps, right? And usually I'll have them do the motions before I even have them turn on their voice. And once I can see that they can do the motions, then I'll have them turn on their voice. And honestly, when we're first practicing this, I really try to go 1 step at a time.
Am I supposed to do it?
Yeah, go for it.
Okay.
So keep your voice on the whole time.
Oh, okay.
And it's interesting to me. I mean, every feature of the R and every way we move our articulators, including that jaw height, is so important. Extra cues, and the way I had this laid out on the slide, it's like it kind of like you're giving more and more and more support. A gestural cue. So I like to use this to cue for retroflex R.
Okay.
I just find that easier. In that article, that Preston 2020 article, they have a hand like this. So that's another option. I just prefer this. But any kind of visual gestural cue you can use like that. I like this too, because I can have the students do it to help cue themselves later on. It's an easy way, you can teach it to the parent. And if they ever, when they're working on carryover, they hear an R miss, they can give a little cue. One option for a metaphor in terms of the way your tongue moves would be to describe, hey, I want you to curl your tongue up like an elephant lifting its trunk in the air. And then the tactile cue, like I talked about before, that you could add to this would be to touch the top of the head and have your tongue tip point to the back.
Got it.
So this is an example of, a lot of these are my favorites. I don't always use all of them. I don't always use this exact combination, but these are some great ones to try for retroflex R.
Yeah, no, they seem really good. And I could see how you would have to provide a little bit more cueing, because we went through these 3 steps, and like, I think I knew how to say the R sound. So I started manipulating my mouth a little bit more, maybe rounding my lips a little bit more. And then we got that sound. So I love like how you break it down and then you're just having them sustain the vowel really throughout that. And it starts to form into that R. So that's really cool. All right. How about bunched?
Okay. For bunched, favorite facilitative context, again, not the only facilitative context, is ear. And I like it because we have eye, tongue, body, and it helps to inhibit lip rounding for those kids who just really want to say a W. And that another soapbox is, if you're hearing any kind, well, really, you need to suss out how much of what's going on for a child is a phonological issue and how much is an articulation issue. What we're talking about today is articulation. So let me just put that disclaimer out there too. That's a whole nother, a whole nother interview, a whole nother presentation.
Yeah, you mentioned that to me when I came to you, when I bought your resource. I had asked you something about a client that I was seeing who graduated, by the way, last week. So,
Oh, that's so
yeah, a
awesome.
little over a year, but he finally graduated. Really great job. But yeah, that was one of the concerns. And you had said like to kind of look at that. So I'm curious to hear more about that too. I ended up I did like a phonological screener, and I think we ended up determining it was gliding, but yeah, and that's probably why he ended up making more progress, because we kind of looked at it like that type of approach instead.
Isn't that, listen, it will never cease to amaze me how quickly kids can graduate from speech whenever the approach matches what's actually going on. Because if you're trying to treat a phonology kid with an articulation approach, I mean, they could be there forever and vice versa, right? Yeah, that's a whole nother thing, right? So, bunched, facilitative context, ear, the visual here. Now for this one, we do kind of have a little bit of a smile going on. And basically, I just talked to them about freezing their mouths and really trying to only move their tongue back. Ear. And one, I don't think I have it on here, but one thing that I will do sometimes, especially if they have trouble with tongue jaw dissociation, is get something. Okay, I'm going to use a pen. Don't stick a pen in their mouth though, but have them bite down on something. You can use bite blocks if you have those. You can use, I'll sometimes tape together popsicle sticks or even like infant tongue depressors. Not very many, just enough to prop their jaw a little bit. And that way it takes out the wiggle chin, like takes it out of the equation, and they can just focus on what their tongue is doing. So that's another way to help them freeze everything except for their tongue. Ear. And for the gestural cue, bunching your tongue. No, this is not my tongue, this is my hand. Bunching your hand back is another great option for a gestural cue. And again, I love it because they can do it themselves, so you can help the parent understand that. I already talked about the turtle in its shell. That's one of my favorite metaphors for helping them understand what their tongue is supposed to do and getting that retraction. And for a tactile cue, you could take like a really small, like a dum-dum lollipop. Remember dum-dums? And then rub the back sides of their tongue. And sometimes I'll even talk about it like, okay, this is my glue. I want you to glue those spots to your top teeth to help them get the side elevation.
I love those. I think those are like super helpful.
I know. There's so many ways to do it, but this is a really good mix and a good variety. So no matter, hopefully you're catching something that will help them understand what to do. And I should add another verbal cue, another metaphor we talked about before would be like, okay, make your tongue like a bowl, which helps them understand side elevation, or taco tongue, or some kind of wing analogy would be another option, or a boat.
Yeah, that's interesting. So it seems like the cues are more like the metaphors. That's where you could have this humongous range, but really like it's just a different types of the cue range is probably much smaller, like tactile or verbal, but the metaphors that you're using could really range like quite a bit.
Oh, yeah. And even the gestures, I mean, you can talk about it like a pirate sound, bear sound. I mean, there's so many different ways that you could even word something. And even when you're giving verbal cues for placement, like I mean, sometimes even the way I describe the way I want their tongue pointing, like this morning I had a session and I had been describing retroflex R as pointing her tongue up. And this child, I asked her to explain to me what she was doing. She's an older kid. Whenever she said it correctly, and she called it flicking her tongue. And
Mm.
that's how it felt to her. And she also said she made her mouth wide, which I had never thought of it that way or said that to her. And she did say pull it back, which that we had kind of talked about. But even right there, I mean, she's not even an SLP, and she just gave me 2 more cues I could potentially use with another kid. So, I mean, and you just never know what's going to click with somebody.
Yeah, that's so true. So, do you have any clients that you remember who it just wasn't sticking? Like you'd been working with them for quite a while, it wasn't sticking. Like, what did you do at that point, or what happened?
I curled up in a ball and I cried. Absolutely. And there is one, there are only 2 clients, I think, ever, our kids that I've had so far, that I just couldn't help. One of them, we got it and then it disappeared, and I have no explanation for how or why. And they were my very first kid ever as a clinical fellow. Like
When
I
you
had
look
one
back,
kid
do you think you could have done anything differently since it was your first?
for sure. I didn't,
Yeah,
I mean, especially with how much I know now, but I just obsess over the R sound constantly, and that's my whole career now. But oh, there's so many things I could have done differently. I just didn't know, you know? I mean, we're all just doing the best we can.
right. Yeah.
So
So
I
you had
think,
that one. You said there was one more.
yeah, there's one more. And that one's like, it'll always be too soon. It
What do you
haunts.
mean to talk about
Yes. I
it?
this poor kid, and you know, and it makes me wonder, like, I am not, if you have questions, people sometimes will DM me and ask me questions that have to do with like the myofunctional realm. And I'm like, I'm not your girl. That is something that I wonder about for this kid. And I wish I could go back
Mhm.
and get her in with a myo assessment, because I'm like, maybe that was it. You know, I mean, I would do anything to go back and help her. And I think about her now, like what's happening and if she ever got it, because I just never could get it for her. It's awful.
Yeah, I was wondering how you felt about Mayo. My daughter just got home from the aquarium and wants to say hello. So I might have to let her in a second. Welcome to toddlerhood.
Right.
Um, but I was wondering how you felt about Mayo. It's interesting. So I had 2 kids working on the R sound simultaneously. Both progressed, like it was interesting. Like they both progressed along the same way. The one just graduated recently. The other one we're putting a pause because this one had a lot of oral appliances. And I'm not just talking about braces. I'm talking about jaw expander, something on the top palate, plus braces. And the R sounded great, but then I started to notice breakdowns in like simple things like the bilabials and multisyllabic words. And like we did an apraxia screener and kind of worked on some multisyllabic words like later on. And then that all got better, and then intelligibility improved. We were at like 95%, maybe even more, but there was still some breakdowns, and then that client would go back and fix it. But I would ask her, like, just getting feedback from her, like, how does that sound feel? Or how did it feel to say that word? And she was like, it just feels really uncomfortable because I'm trying to avoid touching my tongue or my lips on
I
those appliances.
bet. I bet. No kidding.
And you just don't realize like how much of an impact those things can have sometimes. So yeah, we agreed that it would be best to just pause for now. And then apparently they're getting it off in 3 months. So if they're, maybe everything will resolve, because without those, I think, you know, that client was definitely ready to graduate. But I
Yeah.
know I felt bad because like it's hard. Like I'm a perfectionist. I don't speak for the entire field, but I feel like sometimes you get close to graduation and you're like, oh, maybe we can work on like social skills now, or maybe we can work on this. And I feel like
Like,
now there's all of this like acceptance and just like not trying to pathologize the person? Like, what was the initial complaint, and did we reach those long-term goals? And how does the client feel about their progress, really?
Yeah,
You know,
totally. I totally get that.
that's like a whole other conversation, I feel like too.
No, and there are definitely times with kiddos that if you're just not making progress, I mean, exhaust all options and refer out if you feel there's a need somewhere, but sometimes you just got to take a break. I mean,
Mhm.
I don't know.
Yeah.
So hard. And
Carrie
I know it's
Ebert.
not that simple in the schools.
Yeah, I know. In the schools, that's harder. But Carrie Ebert just posted that recently. Like, it's okay to take a break from speech therapy. And I know sometimes that's like not the general consensus. Like, there's going to be a regression, there's going to be a summer slump, but sometimes people need a break. So I get that.
But also sometimes kids, like, I'm sure you've seen this when they're gone for a long break, they come back and you're like, am I even doing anything for you? They've all of a sudden got all these new skills, and not necessarily for the R, but for I'm thinking more for like language, I guess, or phonology, that all they just some things clicked in place and bam, like you didn't even have to do anything, it seemed like. And I
Oh,
feel like
yeah.
for R, it could be that you take a break and they come back, everyone's refreshed, they don't have that mental block, and neither do you, that this is just not happening. There's
Mhm.
negativity gone. We're all open minded again. I mean, you just never know. And maybe something will click 6 months later.
Yeah, it's such a holistic process. Like, they have to be motivated, they have to care about, the progress, they have to care about like self-monitoring and
Yes.
all of that. But yeah, that's
Mhm.
a really good point. Early
That,
intervention, I see that a lot. Like,
oh, for sure.
how much do their motor abilities and cognitive abilities need to catch up with like what we're teaching? So it's just like this dynamic process, really.
Absolutely. And I think for I mean, I always relate everything back to R because that's my thing. That's all I do now.
Mhm.
But that's why I talk about like pre-learning, and there's so many things you can work on with a student before you ever even get to elicitation. Like maybe you're probing in your assessment, but I mean, there's several kids who we don't even try again for the first 6 sessions sometimes. And it's because there's so many things that we can do before we get to that really hard because
Mhm.
elicitation can be so hard. So yeah, I feel like it is holistic, and you got to get that rapport and that buy-in, and there's so many little things you could scaffold, and I didn't know that even 2 years ago. I just never thought about it that much, but now I try to shout it from the mountaintops.
Yeah. Yeah, no, I agree with you. I feel like I'm always bringing things back to AAC. It's hard when you are like so deep into one of those areas, but for a lot of people, like even just watching this, it's really helpful because this is all you think about. It's like all you research, and sometimes you just get a general overview of these areas when it's really helpful because you can make so much more progress if you know like these little, things
Mhm.
about these areas. So,
Yeah, absolutely.
all right. So, what are your go-to strategies for eliciting the art in multiple contexts?
Okay, so basically, what I like to do, and again, there's never just one way, okay? Never just one way. But because we're going through kind of like the way I do things outlined in teaching R, right? I like to isolate from wherever we started, because for me, I can plug into every single context. And what I mean by context would be initial R, vocalic R, R blends. It
Mhm.
helps. R blends. Okay, so the way I teach that is now that they can say ear, and maybe they still need to think about it in 2 steps, or maybe they can just say ear, I would have them stretch it out and freeze. So, for example, they would say ear. I would have them
Yeah.
freeze and then turn their voice back on, or turn it off and then back on. Ear. Er. And once they can say by itself pretty accurately, pretty consistently, I use as a springboard for everything else. So for, I just saw a typo on that second page. Y'all, this resource is like 250 pages. Actually, no, it's more like 500 pages. And I cannot even believe it. That's supposed to say teaching AR on the right side. I'm so sorry.
Oh my goodness.
Good.
And is
So
it supposed to
glad
be teaching EAR on the first one?
No, it's not. It's supposed to be teaching Never mind. We're good. We're good.
Okay. I was like, wait a
I was like,
minute.
am I figuring this out on a live interview? Okay. No, it is because the end result is the ER. We're starting from AR. We're fine. I'm so sorry. I just
No,
thought
that was good because I actually was wondering that at first, and then I kind of read through it. I'm like, oh, we're teaching her with these to
we're
start
teaching.
with.
No,
Got it.
the title is correct. I'm so sorry. Okay. So we're for retroflex, right? If we were able to get that R, or really whatever you're doing, again, we're going to stretch it out. We'll do our 3 steps. I'll have them freeze their mouth and then turn their voice back on. Okay. Now, one of my favorite things about the R, and I use this to my full advantage, is that it can be stretched out forever, right? It's one of those sounds. So like S, you can say it for as long as there's air in your lungs. You can do that for R. So it gives us plenty of time to think about how it feels, think about how it sounds, and that's a little trick that I'm using. So we can go to the next one, unless you have questions. Okay. So all these little mouths on those 2 pages on the right represent ER. To get all of our vocalic R's, I have the student think about it as 2 sounds, as 2 movements, because it is. And the beauty of practicing it as separate movements, as long as it's one fluid motion, it's the same motor plan. We can stretch it out and make it as long as we want. It does not change their motor plan. So we go through the list. We have R, which right now they can say in isolation. So all we're doing is tacking on a different vowel to the front of it. And boom, we have all of our vocalic R's. And I use this visual all the time. One thing I wanted to point out, if you think the vocalic R sounds funny, pay attention. Sometimes it's the R, but often it's the vowel, because they're trying to move into their R before it's time for the R, and they're not giving the vowel time. So that's a little tip.
That's a good tip. So are these in any order specifically, like from easiest to most difficult, or are they just on there?
Yes and no. So the order on these pages, I have them that way, which really for the bunched, I should flip ear and R. I have them ordered that way because that's the order they go through in teaching R. But really once we have from there down, I roughly have them in order of what most students might find easier to hardest. OR is notoriously the hardest because we have that rounded lip, and that just seems so tricky for kids. But I mean, every kid's going to be different. So I many times will kind of go through, I'll have them say each one, and we'll just pick which one we both think sounds the best, and that's what we practice next.
Mm-hmm. Yeah. I'm wondering, I see Amy Graham's stuff a lot about, like, she will say this more eloquently than I'm about to, but targeting like more difficult, like phonological processes or more difficult sounds. And sometimes like that carries over to the easier ones.
Mm-hmm.
And I like ended with OR with these last 2 clients. And that was like difficult because we had made so much progress. And then you get to the OR and you get that rounding back again. I wonder if I like had started earlier with that, if it would have translated better, or if they're just so different, it didn't matter.
I know that there's a lot of research behind that in phonology. Like, I'm going to say something wrong. Phonology is not my strongest area, but like the complexity approach, I think, goes and does.
I think you're right.
The harder things, you do the harder things, and then it trickles into the easier things.
Mhm.
Like a consonant cluster that has 3 consonants will help you get each of those consonants, that kind of thing. Don't quote me on that, you guys.
Yeah.
Google it. But and I know for motor learning, it is helpful to increase the difficulty of the motor plan. So like, whereas ear is a facilitating context for R, or might not be as much of a facilitating context because of the lip rounding, because that could make them want to slip into a W. But different things can be facilitating for different students. So that's an
It
interesting
depends.
question. And I'm curious what kind of, I need to go digging for some research to see if there's anything. Hmm, I don't know.
To be continued.
Yeah, that's a really good question. I like that.
All right, let's see. So we'll
And
talk about
I
some
feel
more
like
go-to
now I'm
strategies.
thinking, sorry, hold on. It depends on the student too, right? 'Cause
Yeah,
if,
totally.
if you, I mean, I would say I would not tackle something harder just for the sake of it translating to other things if a student is already kind of having trouble, because I feel like so many of our students, it's kind of a sensitive thing. Like they've been perfect at everything their whole lives, and all of a sudden there's something they can't do, and that's really hard for them. So I think it also depends on the personality of the child.
That's such a good point. Like giving them a win, giving them something that they
Yeah.
can. It's like a Dave Ramsey approach. I don't know how people feel about Dave Ramsey, but it's like kind of like snowballing,
Uh-huh.
into
Yeah.
this approach.
So maybe you do them side by side, like you
That's a
start
good
with
point.
something they're great at, or like I like to start with reviewing their homework. And
Mhm.
then maybe we do something a little bit harder, and then we end on an easier note and give the next homework or something. I mean, that could be a way to structure the session.
Yeah, good tips. I love that. So, you have some more go-to strategies for eliciting the R in multiple contexts.
Telling you, once we get that ER, it is game on, you guys. So for this visual, I would start with and I have it written like E-R-R-R-R-R. I like to stretch it out, and then we would move into the vowel, and that's how we're getting our pre-vocalic R. So, and I know there are people who would argue with me, and come find me, come argue with me, because I like talking about this stuff. But they would argue that and pre-vocalic are totally different. And I just, I don't know. So anyway, that's an argument you could make. So take this for what it is. But I like to teach them the we stretch it out, and then we move into the vowel. So we would slide our little finger from and then we have the start of a pre-vocalic R word.
So the layman's question is going to say, well, how do you drop the part? What would you say?
And I would say you don't have to drop anything. You're saying it correctly. And once you're saying it quickly, ru, ru, ru. I mean, there's like, see, this is why I want an ultrasound, so I can like really look at it. I guess I feel whenever I'm saying initial R as opposed to beginning with there's less of like a harsh onset, maybe. I like ease into it a little bit more, but there's not a huge difference.
I hear you.
I know. And even I was talking to Dr. Kelly Farquharson, who I cited earlier, and I mean, this is I want to have her like talk to me about this on like an Instagram live or something,
Yeah, you
because
should.
she hears me out. Like she agrees. I think I'm afraid to misquote her, but my understanding of what she said was she agrees there's no such thing as R in isolation. Even R in isolation is like ER. So I've never run into an issue with doing it this way.
Yeah. I don't think so either. I think when I was working with these clients, I mean, I was using this resource, and I was also using Speechy Musings resource for high frequency words one, but
Oh yeah.
that one's a good one too. No, I use this approach, and it kind of just like you said, once they started speeding it up, it kind of worked itself out. So yeah.
I agree.
Yeah. And even when I'm thinking about doing the RN isolation in my head, I'm pairing a vowel after it.
Mhm.
So I can definitely see that it's like not really possible to do it in isolation.
That's what I
What's it?
think, because if I'm setting myself up to say the R, it's automatically ER. Like I can't, it just
Right.
is.
Yeah.
That's how it
Yeah.
sounds to me. That's how it feels.
Yeah. And when I was about to do it in the initial position, it was going to be red, like the E was coming after it. So yeah.
Or-
But I'm thinking of what the next vowel is going to be. Yeah. Makes sense. And
Okay.
then blends.
And then blends. So same thing. So we're just moving from our initial consonant into and then into our vowel. Pray. Bre. Tree. That would be very facilitative. Tree. Duro. And that's
So
it,
with
y'all.
I'd be interested to know, I think like the more, I don't know how to describe this, having word finding difficulties right now, but it seems like from Dr. Kelly Corrson's work that like every R is produced in a facilitative context, in some type of facilitative context. So when you're saying that it can't be produced in isolation, that's because each of them are like paired in some type of facilitative context. Is that right? Or am I like jumping to
Um,
conclusions?
okay, let me think about that. I guess the way I would word that, I feel like this is gonna like make my brain tired. This is getting really deep. I mean, I'm here for it, but I think the way I think about it is it is I okay. First of all, different contexts, whether it's facilitative, could be now I'm having word finding difficulties. Subjective. I think that's the word I want. Right?
Okay.
Like different things could be facilitative to different people. So that's the first point. The next point is my argument is more so that in isolation is a vocalic R and it is vocalic ER. So I guess my argument is that I don't even, now I feel like I've gone off and I don't even know if I'm answering your question.
This just really
But
shows like how complex the R sound is,
it
you
really
know?
is. It
Yeah.
really is. And I'm sure there are people who would disagree with me. And y'all, this is my own little nerdy soul just obsessing about this stuff and thinking about it. Um, so hey, email me if you have thoughts, but be nice, please.
I'm here for it. I mean, that's
But
why I'm asking these questions because it's super fascinating. And I'm so glad that like we had you on to talk specifically about this sound versus like treat all articulation errors this way. Like, you know what I mean? I'm so glad that like we really narrowed in on this topic.
I appreciate that. And I think that R is one of those like just beast phonemes that you really do. I mean, there are kids who have been in speech therapy for 3 years all over the
Yeah.
world right now, and they still don't have the R. So I feel like it is one of those phonemes that deserves a few specialists out there, and I'm happy to be one of them. and I guess going back to your question where I kind of like just word vomited everywhere. I guess my argument is that there's no such thing as R in isolation. So not necessarily that every context of R is facilitative, but there is always a context to R.
Mm-hmm. There you go.
There
That's
you
a
go.
quote. You should use that.
There's my quote.
There's your quote. Makes sense. So here are some of the references that you mentioned earlier. Was there anything else that you wanted to mention about R before we wrap up today?
I don't think so. I mean, I guess I just want people to feel, I mean, I hope first of all that some of this, any amount of this was helpful. And the teaching our resource, like, yes, it kind of has an outline and it helps walk you through the way I have found to be successful in the past, but I don't want anyone to think that that is the way you do our treatment, because just like with everything else in our field, there is never just one path. There's other professions who do it that way, but not ours. We have all kinds of factors, and that's what makes us clinicians, not technicians, right?
There
I
you
love
go.
that quote. But
Yeah, it's a good one.
yeah, so I hope people feel like they have some new ideas to bring into their therapy. They have some confidence that what they're implementing is evidence-based, or at least backed up by some lady who really likes the R sound, and that they have maybe like a renewed attitude about it, because I know it can be really rough.
Yeah, I feel like that's a great way to describe this. Like if someone's feeling stuck in their therapy, like, you can kind of get into the motions. And now we're starting a new school year. So like all of your new kids with R, like you have something fresh to start with them.
Now
So
it's
I
time.
love that.
Absolutely. Absolutely. And start from the basics. And I have information on that available. Come find me and we'll chat about it. Like
Thank
start
you
fresh
for
with every kid if they don't have the R yet.
love it. So I'm sure, most people here are familiar with you, but there's your Instagram handle. Is there anywhere else you want to direct people?
Um, I mean, I feel like that's a great place to start. That's where I put most of my content aside from my email list. Which any link you could ever want, you can find on Instagram. It's a great starting point. But my website also has all of that, speedythings.com. Got a lot of blog posts on there about the R. So
Awesome. Well, thank you so much, Lindsay. And we will jump into our Q&A now, but this was awesome. And thanks for brainstorming some things with me. I mean, I love like getting deep into these topics. So I appreciate you playing along.
no, I loved it. I appreciate the questions. So thank you for having me. I appreciate it.
All right. Okay, we're gonna go ahead and stop it there because Kate, you can just like play it to the end so at least they have her handles there. That would be great. Hi, Lindsay.
Bye.
So I was like, oh, I wonder if some people are going to think this is a little too informal, but you just got a really nice comment in the chat that said, I love how this whole conversation sounds like me and my speech wife talking about our kids. And I love besponem. So that shows something, but we have a lot of questions in the chat. So I will just start presenting them to you, from the top. The first one said, do you have any recommendations for trilled R?
So I do not, but every year I host an event on my Instagram, and I put the videos on YouTube too. I host something called Rock the R, and it happens around back to school. And I had Liliana Vasquez Diaz, I believe. She has a hyphenated name. Anyway, she knows about treating trilled R. And so there's like an hour-long conversation with her that you're welcome to go find, again, on my Instagram or on my website or on YouTube. You can email me if you need help finding it. And she gives awesome advice about both trilled and flat R.
Awesome. And then the next one says, how early do you think is appropriate to start teaching R?
I know it's so controversial. And I think maybe like the next question talks about those age restrictions you have in the schools. And I know that's really tricky. The earliest I have started is like a 5-year-old, like a young 5-year-old. Typically though, these are kids who have already been in speech and this is the last thing hanging on. And while I have them, we see what we can do. I think that kind of the summer between kinder and first is a good sweet spot, because they are a little bit more mature, a little bit more aware. They can follow your directions. They have better proprioception. So those are my preferences, but I'm also in private practice. So I have a lot of liberty in terms of when I can start.
Makes sense. Okay, so this one is a little bit longer. It says, in my ISD, we weren't supposed to address R until the student was 8 years old.
It has recently changed to 5 or 6. Last school year, I inherited a student in the 5th grade who was still working on R. He spoke so quietly, I couldn't always hear him. However, when I could hear him, I almost never heard him say a good Midwestern R. I'm now feeling like I let him down. I will have him again this school year. Is there hope for him?
I mean, the short answer is yes. I think there's always hope. I have teenagers on my caseload right now, and they're making awesome progress. So my answer is yes, there is hope. And something that I am a big advocate for, because I've been there where, well, I've been in the situation where it just feels like we're so stuck and we're not getting anywhere. I've been in the situation where I could have sworn I heard an R, so we progressed. And then one day I'm like, dang it, that's not an R sound. So some advice, not that they asked for it, but I'm just going to assume they would like some advice. I would bust out the Start app. It's free on iPad, search Bits Lab Start. And that is a great visual cue to tell you for sure if it's an R or not. And it's okay to start from scratch. I think it's okay to kind of like go back, fill in the basics, because, you know, something that I think about all the time is how much more I know now than I did 6 months ago. And I feel like that's true for all of us. We're always learning and growing and fine-tuning our skills. And I think back to sessions I had that long ago, and I would have done it so differently. So sometimes I think it's not a bad idea to almost like do a new assessment on the kid, bring in what you know now, and see if you can't fill in some basics that maybe you didn't know about before. And I'm happy to talk more about what I'm talking about in terms of that. But sometimes it's good to get like a fresh set of eyes, is what I mean.
Yeah, no, that makes sense. Okay, the next one said, where can we get the resources in the slides?
I have a Teachers Pay Teachers store, and I have a store on my website, speechythings.com. You can get the resource kind of like featured in this presentation is called Teaching R. It's my bestseller, and I got a coupon code for you guys, or I made one. I didn't get it. But it's SLP Live, all caps, no space. You can use that on my website, or you can go to TPT and you can find it either place. And it's the same price either place, but TPT, you don't have to use a code.
Oh, thanks, Lindsay. That's nice.
I'm happy to treat you guys. And I set it to be available like through the end of the replays.
Okay, awesome. All right, so this one says, I too have taught the vocalic R as 2 sounds, but without success for every student. Using the mouth visuals, gestures, and verbal cues will be entering my therapy. So it's like more of a comment. And then the last one says, sometimes I think the R production is best at a sentence level than at a word level because the rate of speaking at the sentence level helps. I'm nerding about this too.
You know, something I'll add to that though, I totally hear you. And I know, I mean, there are definitely kids where we spend time working on getting things to sound more natural and speeding it up at sentence level, but I would just caution you to make sure that it doesn't sound better at sentence level, because it's not really an R and there's just more to distract from it. So I just feel like it's too easy to think you're hearing it, but you're not. And then by the time you realize it, you've done, weeks or months of therapy. So I'll throw out the Start app one more time, because I'm hooked on that thing, and I love that it's free.
Yeah, I never even heard of that. And I wrote it down.
Oh my gosh. It's a biofeedback app. It's wonderful, out of, I think NYU.
Okay.
They
Awesome.
put it out there. So you guys should go find that.
We will. I think that was all of the questions that I saw in the Q&A. So hopefully we covered everything. Thank you so much for popping on, Lindsay. Thank you for everyone who stayed over. We just could not stop talking about this topic. So we appreciate everyone hanging in. Thank you for a successful SLP Live round, like 3 or 4 now. This has been an amazing experience again, and happy to leave on this note. So Kate, do you want to share anything for people keep in mind.
This has been such an awesome experience. Lindsay, thank you for helping us wrap it up and tie all this up with a bow. If anyone has any additional questions for any of our speakers, you can ask in the private conference community and tag a speaker if you leave and you're thinking about something and kicking an idea around and want some feedback. They are available for you there. Post-tests for ASHA CEUs are due a week from today, and don't be a stranger. Overall, this has just been a really awesome experience. So shoot us an email, tag us on social media. We're excited to hear everybody's feedback.
Yep. All right. Have a great rest of your night, everybody.
Thank
Bye.
you.
Bye.